Food is fuel for your body, your mind, and definitely your sport. But let's face it, nutrition is confusing, and the expectations on girls and women to be thin and have a six-pack are exhausting. If you've ever been frustrated with your body, confused about nutrition, obsessed with eating healthy, or guilty when you don't, underate, overate, or overtrained, and overwhelmed with all the pressure, then this podcast is for you. Nutrition can be easy, you can take control of it, but it might start with letting go of control by asking for help and making a change. I'm Lindsay Elizabeth Cortez, sports dietitian and owner of Rise Up Nutrition, where I empower female athletes to overcome nutrition concerns and perform at their highest level, to stop being confused by all the mixed or harmful messages, and finally have confidence in your body as a fierce, fit, and fueled female athlete.
Hello, fans and listeners. It's Lindsay Elizabeth Cortez, registered sports dietitian and your host of the podcast. Our guest today, Dr. Kelly Baez, is a physical therapist. We talk about her journey to PT and PT philosophy, and then dive into her current practice, which she calls a concierge medical practice, and kind of talk about some of the issues with the current healthcare system and insurance model, which led her to establish a concierge practice. And I thought this was kind of cool to get into this topic of insurance and finding the right practitioners for you. As a reminder, in episode number 190, we had a medical doctor, Dr. Jana Battenberg, who also established a concierge practice. So I just thought it was interesting to have these two guests in two different fields adopting a similar approach towards treating patients because of their concerns with the way the American healthcare system is currently working. After that, we dive into chronic pain specifically and pelvic floor. And within those two topics, we dabble a little bit in how nutrition might play a role in chronic pain and pelvic floor as well. I think a theme of this episode is like really holistic care and individual care. Before diving into it, I want to remind you, head to femaleathletenutritionpodcast.com for all the things. You can subscribe to my email list. You can support the show with a financial donation. You can find resources and help. If you need help from other dietitians or physical therapists or doctors, they are listed on there. You can also access some discount codes for various products that I've teamed up with as an affiliate. So head to femaleathletenutritionpodcast.com. It would be so helpful if you did consider a financial contribution to the show and the mission of improving the nutrition and therefore lives of female athletes. You can choose to donate just $1, $5, or $10. This is a free podcast that I feel like is jam-packed with transformational knowledge, especially since it's been going on for 3 years now. We have almost 200 episodes. Oh my goodness, are we past 200? I'm not sure which episode number this is, but we have so many episodes, and I know you might not have the time in your life to listen to all of them, but if you head to the website, you can search a topic. I just think we have so much free, life-changing, helpful information, credible information on this podcast, and this podcast is free, but it's because of fans and listeners like you that I can keep it going. If you are able and willing to provide financial support, head to the website, click that support button. Even just $1 a month goes a long, long way in helping with this production. I would just truly be so appreciative. And one more thing I will ask of you is that if you do like this podcast, if you are listening on Apple or on Spotify and you have an account, go ahead and give us 5 stars, maybe even leave a comment so that we can reach more viewers. I'm here for all female athletes. There's a lot of us. We've got to get more listeners. We've got to get more listeners, more viewers to hear this amazing information. So if you can support us so that we can keep putting out episodes and then give us a 5-star rating so that more people can find us, I would be so, so, so grateful. Links are in the show notes. And also you can head to femaleathletenutritionpodcast.com. All right, let's read off the bio of Dr. Kelly Baez, and then you will get to hear from her directly. Our guest today is Dr. Kelly Baez, physical therapist, doctor of physical therapy. She is a CEO, mother, wife, pet owner, and nature lover. She owns a concierge medical practice, Brisa Wellness, that offers personalized care plans tailored to your lifestyle. Brisa stands for breeze in Spanish, which represents the emphasis on our body's environment and movement. Dr. Kelly Baez holds a doctorate in physical therapy from Nova Southeastern University and a Bachelor of Science in Health Sciences from the University of South Florida. Before starting her own practice in 2021, Dr. Baez worked as a doctor of physical therapy at Baycare, caring for patients with varying health conditions that included neurologic, pediatric, pelvic, orthopedic, and vestibular disorders. She is a dedicated mother, wife, pet owner, and lover of nature. With a background in teaching, Dr. Baez believes that health, education, and the development of oneself are key pillars to achieving quality of life. Dr. Baez is bilingual, Spanish and English, and helped raise money with her friend for pro bono physical therapy trip run by the NSU Tampa to Puerto Rico following Hurricane Maria. Dr. Baez believes in giving back to the community to support all individuals and their families. Thank you so much, Kelly, for joining on the podcast today to talk about all things physical therapy and women's health.
Thank you so much for having me on the podcast. I really appreciate it. I'm super excited to be here. Thanks for the great introduction. It's definitely a mouthful when you sit there and you listen to that, but all it means is I really love to help. So yeah.
Absolutely. And that you have background and education that makes what you do and say valuable. So let's bring some of that to our audience today. And I want to hear a little bit more about your background. Why physical therapy for you as a career field? Do you have a story as to why you picked it, or did you just pick a career out of a hat and decide to go to school for it?
No. So what happened, it's always an interesting, funny story. I try to summarize it as best I can. I was in early education. I worked with children between the ages of 18 to 28 for 10 years. I was like the VPK teacher that loved to get down and have a good time and play different games and help teach them their ABCs. So I really always loved education because I feel like it's such a foundation for growth. And I really enjoyed working with children, because I valued education, but I came from a home that was a good home. But at the same time, my parents were divorced and there's just a little instability. So I wanted to make sure that I helped children feel safe and stable and just in a very loved environment.
Yeah.
So I did that for 10 years. And then I met a little girl named Megan. So I always attribute this to her. And she walked on her toes. And so she was going to physical therapy twice a week. And she really loved being with me, but she also adored her physical therapist. And at that time, I was looking at a transition in my life of I love working with children, but I really love just helping people in general. What else am I passionate about? And something I'm passionate about is, other than education, is being healthy, making healthy choices, making healthy life decisions, quality of life. And so I decided to go ahead and take a personality test. So I took a personality test and boom, physical therapy came up.
Oh, wow.
That's interesting. So she was talking to me about it, took that. And then of all things, it's very weird and serendipitous. I got in my car and a commercial came on about physical therapy and nighttime courses you could take to be a rehab tech. It was a couple $100 for a few weeks. And I just was like, okay, I'm going to go ahead. I'm going to take this for a few weeks. It's only a couple $100. Let's see if this really is a fit for me or not. And I fell in love with it. I fell in love with physical therapy. And so that's when I went back to school, finished my undergrad. I was already a mother at that time, and everything like that. And then I proceeded forward and got my doctorate at Nova Southeastern. I moved to Tampa and so forth and so on. Hopefully that made sense.
That does. I love the career shift, like taking a personality test. I wonder what would come up if I did that. And if it said something totally different, than what you were doing. Very interesting.
It is. I enjoy that. Another quick thing that I've never shared on other podcasts that I really enjoy is mental health and psychology. and ironically, forensic psychology. So my guilty pleasure is watching true crime shows and understanding personalities and understanding people. I just want to understand people and how to help people. So I think that's always going to be a part of me
Yeah.
where I go.
There's through lines there. Understanding people's behaviors affect and their mind and what they're thinking affects their choices and their healthy choices they live. And then also, understanding the mind helps understand little kids as well and what they were doing for your first career there. So,
yes.
Wow, very interesting. And so again, through lines here, you like to help people. You want people to live healthy lives with good quality of life. Do you have like a philosophy, a physical therapy philosophy that you might summarize or, something that you try and bring to each patient that you serve?
Okay. So one thing is a slogan of mine is like, let's get mobile, because I want people to stay mobile and active, no matter where they are at in their life to their best ability. And the other is quality over quantity. So the concept is each person is an individual. And I think a lot of times in the healthcare system, providers can get overwhelmed. And in getting overwhelmed, people start becoming numbers instead of people. And, healthcare is a business. And I understand that. You got to keep the lights on. We'll get into that later as I get into the concierge topic.
Yes.
And I respect and I understand that. But at the same time, we need to make sure that we're giving quality care.
Yeah.
People are investing in us, their time. They're coming to us for our expertise. And so that's why I say quality over quantity. Like all my patients, I treat them one-on-one. I also do 1-hour sessions as well. So everything I do is very thorough.
Yeah.
And I do even if somebody wanted to meet me before their first visit, I do what I call a wellness consultation. And I run specials on that where people can meet me, for 30 minutes and ask me questions because I want them to feel empowered.
Yeah.
They're in the driver's seat. They're telling me what's happening. And then it's my job to formulate a plan that fits them.
Yeah.
And that's why I specialize in so many areas, is because also I say the body is a system. The body's a system. Even though I still do all physical therapy, it's all within my specific scope. I specialize as many things as I can within that area to help, the body heal. But then I also have affiliates, such as yourself, like registered dietitians, mental health counselors, chiropractors, all types of different affiliates so that we're looking at the whole picture.
Yeah.
So the biopsychosocial model.
Absolutely.
It's not the biomedical model anymore. I mean, some people still attribute to that, but that's a little old school. It's not just the arm is broken. And we'll get into this again later in the podcast, there's pain that comes with that.
Yeah.
There's chronic pain that can come with that if you don't treat it soon enough. That affects you emotionally and mentally. Now it affects you financially because you can't do what you normally would be doing. It's a whole scope.
Yes, I love the way you are presenting this. And that term biopsychosocial model is one that I think people in tune with the healthcare field are starting to hear more often. And you kind of already alluded to maybe some issues with our current US healthcare system because it is an industry. But it's crazy because most, I can't speak for everybody, most of the people that get into it, like yourself and myself, we're getting into it because we care about helping people live healthier lives and better quality lives. So, we do care, but there's something about the industry that can morph the way that we practice. And so you built your practice in 2021 to make sure I'm going to give quality one-on-one care. And you describe this practice as a concierge practice. And I want to refer my listeners back to episode number 190 with medical doctor Jana Battenberg, who also just opened a concierge medical practice for her patients. So this is a new term that we are hearing. I want to hear from you. What does this mean to be a physical therapist with a concierge practice?
So what it means essentially, and there's actually a few others out there. Shout out to John Payne. He had a concierge practice over in Denver, Colorado. Like you said, there's other individuals who are starting it. But what we're basically saying is, we understand that insurance is there, right? And that people use their insurance and there's chronic illnesses. And we understand that that can get rather expensive. And when I think about extreme cases, I understand insurance in those situations. I really, really do.
Yeah.
But we need to be paying attention to still the care and the level of care we're getting if we're investing in insurance. You're paying a premium monthly. You're paying copays. You're paying gas. And you're investing time. And think about how much time you're in the waiting room. And think then about how much time in comparison that you're spending with your doctor.
Or how much time you wait for an appointment.
How long?
Sometimes you call, you don't get in for months.
For months. 2-3 months or more. So you're investing all of this because you're trying to follow a system, right? That we've all kind of been indoctrinated into over time.
Yes.
Just kind of considered a societal norm.
Yeah.
And frankly, I understand that. But that model has some flaws in that. And what's happening is that it's actually become, instead of a healthcare, it's a sick care system. And then on top of that, it's become more reactive. So another quick personal note, like in that case, my husband, so we did accept insurance actually for 2 years. For 2 years, we were brick and mortar. We weren't even mobile. So in 2021, all the way up until last September, a year ago, we had that and we were doing the insurance, and the reimbursement, one, was not coming in. People were not being able to get their medical rides in, which were a part of their insurance. And they were, because of the reimbursement, just so people understand, it wants to try to force you into this cycle of seeing more patients at a time. Because if you don't do that, you cannot meet your overhead.
Yeah.
That's what's happening. That's why you see your doctors spending 10 minutes and moving on. They're trying to make their salary, keep the lights on, keep everything going, because insurance is rewarding them. If you do it faster, if you just work faster, that faster does not always mean better.
Nope.
It does not. It does not always equate to better outcomes.
No.
So I noticed this trend and I just said no. And then I also had the personal experience of my husband. Very unfortunately, he has family history of stroke and heart attack off his father's side. And when we were on vacation overseas in Dominican Republic, because my husband's Dominican, he had a heart attack.
Oh my gosh.
And it was a lot.
Oh.
And I saw how their healthcare system worked when we were over there. He had to get 3 stents put in. And then when I came back and we had to pay all that on credit, the insurance still hasn't paid us a dime.
Oh my goodness.
We haven't seen a dime, and that was over $30,000 to $35,000.
Oh my goodness.
And we have a PPO Aetna plan, and this is nothing against you, Aetna. I'm not trying to slander anything. I'm just simply saying,
just sharing your story.
I'm just sharing a story and saying we did not see anything come of that.
Yeah.
And so what I said is, why?
Why are we even paying into it? Yeah. Yeah.
Why are we even paying? There's a serious situation that happened. And so this is why a year ago we transformed. I said, I'm going to reduce the overhead in my business because I want to spend more time with my patients. I'm not the one sick. Let me go to them. So now I'm going to be mobile, and let me be concierge, because I don't want, frankly, individuals who are not seeing my patients dictating how many visits they need, how long I need to be spending with them.
Yeah.
I want to be the one, because I'm the one who went to school for that. And I know what my patients need.
Right.
So that's why I did it. So concierge is just saying self-pay, and there's memberships, there's discounts. We take all of that into consideration, and we run specials. We try to make it as affordable as we can. But if people were to add up, again, the time they take off of work, the gas they spend, all these copays and everything, and think about it, because usually it takes you longer because you're only having short time with your specialist.
Yeah.
So now you have to be seen for 24 visits.
Yeah.
Well, add all that up.
Right.
You could have been seen.
You could have had 12 one-on-one quality sessions. Yeah. Where you go to them. Amazing.
So, yeah.
I think also, I don't want to get into politics because I'm not well versed enough.
Yeah.
But I will say, our politics play a role in healthcare and making guidelines for this? And are we offering healthcare plans that have flexible spending accounts, and increasing the amount there? Because, I don't want to say people shouldn't have insurance. There's other needs for that. You get in a car accident, you need to go to the hospital. But although, unfortunately, when you were in the Dominican Republic and your husband, that didn't work out. But, there's a need for insurance. But I think that the expanding maybe flexible spending accounts so that the individual themselves can choose where this money is going towards and choose a provider like yourself. And of course, we can also pay out of pocket and just say, I don't need this fancy insurance plan, but I'm going to pay out of pocket for the care that I really want that's actually going to make a difference. And I'm not practicing right now. I'm not taking on any new clients, and I'm not mobile, but as a registered dietitian, since 2018, I established an online practice, and I also decided not to take insurance because the billing and coding, somebody would have to have a specific nutrition diagnosis. And it's like, you know what? Sometimes people are coming to me just trying to better their lives, especially I work with athletes. Like, okay, we don't have a specific disease state that I can bill insurance for. You're an athlete, but you have a role for nutrition to improve your life. That's something you want to do to improve your sport. And so I found the same thing to be true, for me, that even though it was hard for people to pay out of pocket to choose my services, I could guarantee them we're going to have quality one-on-one sessions. You're going to be able to reach out to me at any time. I can't bill insurance for how often I'm texting and messaging you, but we can have this membership style program where that's included and getting you the help and quality care that you really need. So again, I was in a different space, both nutrition and online, but that similar care for the individual and treating them holistically, seeing them all the way through. You have the knowledge of what they need. So being able to provide that without the restraints of our current healthcare system or insurance policies kind of dictating. So it's a very complicated topic here in the US, our healthcare system, but I love, that more providers themselves are just deciding what is the right fit for me and the clients I want to serve. Right. And so this term, you are now the second guest on this podcast using this term concierge practice. And I love that term. So maybe if and when I get back into working one-on-ones with clients, I'll reshape my business model and consider that term as well if it fits.
I was going to say, and the thing is a lot of times people associate the word concierge with very fancy and affluent. But if you look at your plans, there's two things I would encourage. One is try, if you can, to get a PPO plan. That allows you to choose your provider, but it also allows you to potentially get reimbursed. It's something that you have to check with your insurance company about. And if they require medical notes or something, in my case, I'm always happy to provide that so that you guys can get reimbursement. So as a PPO plan is the best in that case. And then also, it wasn't like I took an oath for the affluent. The way that I balance it out is the memberships. And then I also do pro bono, which is free services and community services where I do events and I help other nonprofits. So that's how I give back.
I love
is I make sure that I'm always contributing in some way or another.
Absolutely. Absolutely. I love that. So as you mentioned earlier, and thank you for that discussion. I don't know that I've ever gotten quite so deep on the podcast before about like insurance and healthcare. I've dabbled, but that was, I think, a great discussion for our listeners to hear and just be aware of, what your providers are going. Like we care for you, but sometimes we're restricted. And so there's different types of services and ways that we can work around that.
Yes.
If needed. So you mentioned earlier, you treat the whole body and you're going, whatever patient walks through your door, you're going to treat what they need. So you have many different specialties. Yeah. One thing that we brought up in coordinating before recording this podcast was the topic of chronic pain. So I would love to dive into this a little bit. Sounds obvious, acute pain versus chronic pain. But again, I do specialize in athletes and we tend to have a lot of acute pain. Oh, we rolled our ankle. We have, we broke something. We strained something that was fine one moment. Suddenly it's not. We got injured quickly and we have this acute pain. But can you, in your own words, sort of give us a definition describing what is chronic pain? What does that include? What does that look like? Because it could be an acute injury that lasts, but it also could be something different.
Yes. So let's talk about this. So I think that was a perfect way of looking at it. So as clinicians, when we're looking at things, we're looking at it in time frames, right? How long has somebody been dealing with the symptoms? So if we're looking at a couple weeks, right, that's more acute. Past 2 weeks, now we're getting into more of a subacute range. Anything past 3 months, we start considering it chronic. Why do we define it as chronic? The reason is because we're trying to dictate how much effort or intervention is going to be required to try to alleviate or even potentially reverse what's happening with you. And the sooner that you are able to be seen, I'm not saying if you have a hangnail, unless it's infected, that you need to just run in. That's not what I'm indicating here. But what I am saying is you need to pay attention to the type of pain that you're having. So if it is general soreness or aching, that's more muscular, right? That's something that's more muscular in nature. If it's something that's more throbbing, sharp, or stabbing, now we're talking something more serious. And we're looking to the degree of the level. So the number. So everyone always does the 0 to 10, right? 0 is nothing and 10 is supposed to be ER. I always joke, like if you're female, labor. It's something high, right?
Yeah.
And 4 or 5 is right in the middle. I always describe 4 or 5 as maybe I need to take a form of pain medication, or some form of alleviation. It's right at that middle ground. And if you're at a middle ground, moderate to severe, you definitely need to be going in and getting seen. Because at that point, especially if it becomes constant and it's not intermittent, that is your body's way of trying to get your attention. And what's going to happen if you ignore it is your body is going to start upping the ante. It's going to start incorporating other signs, symptoms, heart rates, right? Increasing. It's going to try to elevate this because it's trying to say you need to pay attention. Like I said, but if you go past 3 months and you're doing this, now you are in a chronic phase. So in my case with physical therapy, there's something called chronic regional pain syndrome, CRPS. And so it could start out as something simple, like maybe you rolled your ankle, like you said, and you didn't think anything of it, right? It's not that big a deal, but suddenly it's constant. And what was once mild and achy is now sharp and it's throbbing. Now you have discoloration. It's red. It's swollen. It's numb. It's tingly. And as you start seeing these things, you are going to get a little nervous, obviously, and you're going to want to use, the tendency is to use it less, right? Because the body's trying to protect itself. And with it protecting itself, what's happening is if you don't use something, the body will almost just shut down function to that part. It's almost like a self-amputation. It's very strange. And so it's like, oh, well, you're not using me anymore. So I guess I just don't use my right foot. That's what your body does. And so I'm not saying like go into the gym and over push it and overload it. What I'm saying is
you got to get it mobile.
You gotta get it mobile, and you need
going back to your philosophy.
You got to get it mobile, and you need to go in and see a specialist who does know the exact exercises you need to be doing in that moment and get some good manual work in. A lot of clinics, no offense again, but it's why I do one-on-one care. They don't have time to get in that manual work. They're going to throw on a TENS, unit, or they're going to throw on some ice. And those are good modalities. But you also need manual work.
Yeah.
Hands-on. How do I really know what's going on with you? Unless I'm feeling that and understanding it. And you're giving me the feedback. So that's why I only do one-on-one work.
Can I share a quick story?
Yes, please.
In my personal experience with physical therapists, and I might have shared this on some previous episodes, but throughout high school and college as an athlete, I would see physical therapists and I didn't get that manual work. And so I never found my treatment to be super effective. It's not that I discredited it, but I just was like, the ice and here's your exercises. That didn't work. When I was 26 years old, I was about 6 months post-surgery on my ankle, and I finally had a physical therapist who put her hands on my ankle. That was still swollen 6 months later, and I didn't have good mobility. I was doing my exercises. It wasn't. She put her hands on me. She moved my ankle. It was magic. Right before my eyes, my swelling went down. And then she was like, okay, now that we can move your ankle, let's do exercises now. For 6 months, I was trying to do exercises on an ankle that wasn't mobile yet because I didn't have a therapist do manual therapy. So that my eyes were open. All of a sudden I was like, oh, this is what manual therapy is in physical therapy.
That's called, and to be frank, even though we have the education to understand how an ultrasound or a TENS unit or what cold or moist heat do, we understand those things and how they help. We need to be understanding as doctors of physical therapy, if we're going to claim that what we need to be doing is skilled.
It was very skilled.
If I tell you to go in a corner and do some marches and pump your ankles, and then I throw you on ice, you can learn that over YouTube.
Yes.
That's not skilled.
Right.
And it's wrong. It's wrong. And so that's why I say, it's very important to apply all these different things, the manual skills, the different modalities, the proper exercises for that individual that they're able to maintain and perform, empowering them, educating them, showing them what's wrong. That's what we're supposed to be doing. And I don't want to jump ahead, but you asked about a question you haven't asked it yet. Sorry. She gave you questions ahead.
Let's go jump ahead.
About pain perception. And this has to deal with chronic pain neuroscience. So do males and females perceive pain differently?
Right.
So I don't know what research you found. I'll let you talk about that, but I'll just talk a little bit about what we learn about with our degree. So,
I didn't have time to research.
Oh, okay.
So you talk. I was like, I want to talk about this. Maybe I'll have time to research. I didn't have time. So
that's okay. That's okay. No, so pain. So little weird fact here that I always ask my patients, are there receptors for pain in the body? So I'll ask you, do we actually have receptors in our body for pain?
I don't think so.
So yeah. And I don't know if I kind of alluded by the way I smiled, but no, we actually don't. Now we do have receptors. We have nociceptors for stretching that tell us, hey, you've stretched too far or not enough. We have baroreceptors for pressure or mechanoreceptors. And we have, all types. We have temperature gauges, but we don't have a pain one.
Right.
And the reason is because when we go to touch something, right? Say we touch something hot and we have our withdrawal reflex, right? We go back. That's hot. Now the signal's been sent back. The brain's, received it. What the body interpreted was the heat change, right?
Yeah.
But our perception of it is all very different.
Yeah.
Depending on who we are.
Right.
That's why some people can come in with sciatica, which usually is rather painful. Most people, it's still pretty high. But for some people, they're like, I'm at a 20. They're not even on this scale. And then others are like, I'm at a 5.
Yeah.
It's all about perception and the alarm. And it's depending on how long, again, it's been going off in the mind. So if you've been having that for a long time, the body is upping that ante, like I said. So now it's like originally it was just a little disturbance, a little annoyance, right? But now it feels like a full-blown fire in your foot, right? It's just crazy. And the body is just upping the ante. And now your perception is changing. And so that's really what it is. So men and women, they joke and they say that if men get a kidney stone, that's as close as they'll ever get to labor, right? But if we think about that, the ureters are really tiny small. They're really tiny small. And a stone in there feels rather large to them and painful, That's where women are delivering children, so it's really the person. It's the individual. Do they deep breathe? Are they meditating? I believe a lot. Like, I have a 15-year-old son, when it was my decision, if I could, that I wanted to try to do it as natural as I could. My sister was trained in hypnotherapy and hypnobirthing.
Yeah.
And that was the method that I used to deliver my son. If I had needed to have something, I would have. But again, it was mindset.
Yeah.
It was mindset and breathing and perception. And I was able to work through it.
I used during childbirth, and I did use medication in both of them, but I had two totally different pain experiences, even with medication.
See?
So I want to put that out. Even those who might use medication or an epidural might still experience a lot of pain, as one of mine was significantly more painful than the other. But in the one that was significantly more painful, I tapped into meditation during childbirth as well, and using a mantra to get me through it. So that was incredibly helpful when, I'm thinking I'm a 10 out of 10 pain right now and I'm not even pushing yet. How can I possibly get through this?
Mm-hmm.
I tapped into the mantras to change my mindset. So so it's very interesting. So there's real, whether it be biomechanical, it's not neurologic. That's more with the brain. Or maybe, what's the term for nerves? Is it neurologic?
Yeah, no, it's neurologic.
Okay.
Yeah.
Okay, great. Sorry, I confused myself there.
You're
Biomechanical, neurological, biological, whatever. There's things, there's receptors, there's compounds and chemicals that are receiving signals in our body that make something physical going on in the body. But the pain we experience from those physical changes is still a perception.
Correct.
And there's a lot that goes into that. Like what we're alluding to with chronic pain, the longer something goes on, the perception of pain can increase because it's been going on so long.
Mm-hmm. Exactly.
I kind of want to circle this back. And again, I didn't do my research on this, but I have heard that there is a disparity between how men and women are treated in a doctor's office for pain.
Yes.
There's this classic example of, a man goes in with pain and it's like, oh my gosh, screen him for a heart attack. A woman goes in for pain and it's like, go home, you're fine. And I wonder now, hearing this, that the more that women's pain is discredited, then potentially the longer it goes on for and the more chronic it turns into.
Mm-hmm.
Is this making sense, even though I didn't do my research behind this?
No, it's making perfect sense. And actually, yes, this is a common thing that's been studied, is they feel like, between the two genders, potentially, that women can make a mountain out of a molehill, as the saying goes. And we can just kind of overinflate and over-exaggerate and malinger. And there's all these concerns as to where the man might downplay it. Why? With that concept, even though that's wrong. And I don't think that should be done. And it also goes for race too, by the way. Yeah. I was going to say it's not just gender, but that also goes with race.
Racial disparities.
Yep, racial disparities, economic disparities. There's a lot that this is very real. This is a very real thing. But that they'll go ahead and they'll try to say, men don't talk as much and women talk more. So that's why I think that they feel we're exaggerating, is because we'll want to explain more.
Yeah.
And the man will tend to want to be quiet more. And what they actually say is, if a male is going to the doctor, that a female should go with him, because she'll say things that he might not say, as to where they're worried that the woman is going to talk forever. So they want to cut us off. But what if there's something important that we're saying?
Yeah.
What if that one thing is the thing that would make the difference?
Yeah.
So there has to be everything in moderation. What I explain to everybody before they go to any appointment is they should make a list of questions, concerns, symptoms that they have, and just say that. Say that when you walk in. Okay. And just be prepared. Hey, this has been on my mind. It's been happening for this long. These are the things I'm experiencing. These are my difficulties. Right? Mm-hmm. And then hopefully they've reviewed your chart. Hopefully they've reviewed your chart and actually looked at it. And if there's something that you feel that they maybe are missing, that you feel would be important, bring that up to them, because they need that picture to not only just to diagnose you, to actually treat you, the way that you need to be treated.
Mm-hmm. Yeah, I'm going through this with my husband. He has chronic pain and I'm the one pushing him. Go see providers. He's finally seeing some providers, but I'm not at the appointments with him. And I'm like, tell me, because I want to describe to his providers, what we are living with,
Yes.
what he is living with. And it just feels so slow moving because I'm not part of the appointments with him. But thank you for that explanation. And I think I did not prep you for this, and
No, that's good.
I'm the dietitian in the conversation.
That's fine.
But I'd love to hear from you if you believe there's a role in nutrition in the management of chronic pain. We just spoke about the role of physical therapists and the role of mindset and mental health in the treatment of chronic pain. How about nutrition? Where do you see that play a role?
Nutrition-wise, 100%. Because there are certain things that are inflammatory for the body, and depending on the individual, that can be contributing to the pain. The body's the entire purpose of inflammation in the body is to bring forward different, immune kind of boosters into that region, because the body is saying, hey, there's damage here or something's not functioning right. And you bring in the megakaryocytes and all these different white blood cells, all these different types of things from the immune. And that blood brings all that in, circulation increase. That's why you see the increased redness, right?
Mm-hmm.
Or swelling. You don't always get that, but it is a part of it if you do see that. But that's what's really important, like the inflammation and allergies. So that's huge.
Yeah, I believe with all injuries, acute or chronic, focusing on the anti-inflammatory ingredients, antioxidants.
Yes.
Protein as well for those recovery and building nutrients.
Yes.
Amino acids, taking a closer look there. Hydration.
Yep.
Too, to get all these nutrients moving through your body.
And to flush out any toxins. You're trying to
flush it all, right? Flush out the what we're trying to get rid of. So the inflammatory ingredients, we're trying to get rid of that, flush it out. And then, so the nutrients are at work here. And then going back to like the holistic care, it's how does one behavior create another positive behavior? So if you can set that nutrition goal, I'm going to fill up, let's say 3 liters of water today and finish it before the end of today.
Yes.
And you make that one positive change. Now that extra hydration is helping you just have a healthier internal body to help you through this recovery. That positive choice might also make you feel better mentally. Oh, I have a more clear brain now. I don't have a headache. I'm not so foggy thinking.
Yes.
So now we're in a better mental headspace to handle our pain better. And then maybe that because we're in a better mental headspace, we take those extra 10 minutes to do our exercises or make the phone call to our physical therapist to book the follow-up appointment. It's that one healthy behavior can be a cascade to more. And so it's the actual nutrition, right? Playing those anti-inflammatories, those omega-3s, those, berries and nuts and seeds with their antioxidants that are playing a role on the biomolecular level. And then it's also the behavioral component.
Exactly.
In the management of chronic pain, from a nutrition perspective,
yes,
I would also urge people to get some blood work done to look at their blood biomarkers, including micronutrient status and hormone levels.
Yes, please.
And I might recommend this for people in a variety of different settings. But again, chronic pain, it's like, okay, this has been going on for a really long time. We're looking maybe at the shoulder. We got to look holistically. We got to look at the mental. We got to look at the nutrition. And I think that taking a look at blood biomarkers could be very important as well, because you might see, well, okay, no wonder this isn't healing if, I'm not getting all the nutrients that I need. If I need to focus on my vitamin D levels. So I think that might not, it's not like fixing one nutrient will heal the chronic pain, but it can help push you along further in that journey.
It is so let's be proactive, not reactive. Let's try to help the body heal. The body wants to heal, you guys. I say that all the time.
Yes. Thank you for saying that.
You're welcome.
Yeah, the body wants to heal. One of my little slogans I found myself saying to clients over the years is that your body is working for you.
Yes.
Sometimes, especially in the case of pain, in my case of nutrition, people just feeling like their metabolism isn't working right.
Mm-hmm.
We can often feel like our body's like working against us. We're in a fight with our body. Why is it doing this to me? Why am I not healing? It's like, no, your body is working for you. You got to get on the same page of with it and start working with it to heal and start providing it with the nutrients,
Mm-hmm.
providing it with the mobility work, giving it what it needs to function.
One of the things I always ask, so I'm asking, what do they do for a living? Do they have family, spouse, what have you, children? And then we get into that because I just briefly want to understand diet, even especially we haven't touched on it yet, but pelvic floor, that has a lot to do with it. Actually,
Yeah,
it does. Hydration and whatnot, because soda, coffee, tea, juice, those are all bladder irritants and can contribute to incontinence.
Mm-hmm.
Water does not do that. Your body is 80% water. Your body wants water.
Yes.
The other things are nice little add-ins as you can, but what it's requesting is water and proper nutrients. So you need water, proper nutrients, good sleep, right? At least 7 to 8 hours. None of us seem to be getting good sleep.
No.
But how do you expect your body to repair
I know.
and work for you if you're not getting that?
Mm-hmm. Girl, you're pumping me up right now.
Sorry, I was just like, but it's in a fast-paced society. What happens is we've all learned to push.
Yeah.
And what I tell my patients all the time is, hey, give yourself that gift. You are that important. You are that special.
Yeah.
I mean, give yourself the 30 minutes to walk.
And even more athletes, told push.
Oh yeah.
Go, push through the pain, fit in the double session. It's like,
yes.
I don't know that I want to use the phrase slow down because I know they don't like that because I don't either. But I think give yourself the gift of what your body needs.
Give yourself that gift because otherwise you get Tommy John injury. You pitch too much or you get golfer's elbow or tennis elbow. And it's because
runner's knee,
all of them, runner's knee, you're sitting there and you're push. I need to keep going. And I always ask everybody. So if they're an athlete, since we're talking about it, I always ask, do they have a rest day? I always ask that.
I do too.
I do. Do you have a rest day? Even just one. I like two, but if you can provide me at least one. And then I want to know, what other cross training are you doing? The body, if you're only doing one thing all the time and using it and pitching, what do you think is going to happen to that elbow? What do you think are going to happen to those ligaments? They're going to get damaged, overused, hurt. But what if you play some, if you're a professional athlete, as an example, you do baseball, because I'm saying baseball a lot. So you do baseball, but then you switch it up and you do some strength training or you do some cardio or you swim or you do something else.
Yeah.
You're still using the same muscles, but in a new way. And now the body has the ability to relax. I'm not pitching.
Absolutely.
Yeah.
Do you have time for our next topic? Because we're at the top of the hour.
I know. I'm paying attention. So I do. I have a little more time. So shoot, go right ahead.
Okay. Because I had one more question. I'm like, we can skip it if you don't have time, but let's see if we can drop some knowledge bombs on our audience real quick. Because you're a physical therapist and this is female athletes, we mentioned, pelvic floor just seems to come up a lot. Maybe not so much for our younger athletes, although it might, but it seems like as we age, this is a time. Like I'm in my 30s, I've had 2 children. This is a thing now to take care of my pelvic floor health. So what are some of the top pelvic floor issues that you see and treat?
Okay. So, and I do want to say one thing on that because you're talking about young athletes. Something that I do want you guys to pay attention to, which is a little off topic, so I'll have to stay. I know we've been all over the place having a good time. Pay attention to polycystic ovarian syndrome, PCOS. Also, please pay attention to the athlete triad.
Yes.
These are things you need to be paying attention to. Okay.
Yeah.
Because those are commonalities. A lot of times you're overtraining. That changes your menstrual cycle, right? It's changing your hormones. You need to be paying attention. That's why her talking about the blood markers and hormone levels is so significant, guys, because when you look at that, you're able to determine where those levels are at. Because particularly for young female athletes, those are changing all the time, especially determining where you are in your phase.
I'll add in, there's some newer research that shows that urinary incontinence is a symptom of the athlete triad and REDS, relative energy deficiency in sport. And it's likely due to the altering of hormones, lower estrogen. But so you might be thinking, do I have a pelvic floor issue? I'm having urinary incontinence when I train or otherwise. Mm-hmm. And it could be one of many symptoms of the triad and REDS as well.
Exactly. So please pay attention to that, guys. That's why I'm talking about the rest days and the training and paying attention about the overtraining.
Thank you.
But when I look at pelvic floor therapy in general across the board, first thing actually what I want to say, because we're speaking specifically to a female audience, but I'm sure you guys are aware, males and females both have pelvises.
We do. Yes. All people. Thank you.
So I treat both males and females, and I do internal and external work, typically because the pelvic floor, there's some external genitalia, but then there's internal muscles specifically inside, which are important and dictate how we urinate, how we have a bowel movement, and if we are active, how we are interpreting like our sexual activity, right? Is it painful or is it pleasurable? So with that being said, those are the three things I usually screen. So say somebody comes in to me and they say, oh yeah, like I'm having some lower back pain. And I'm like, oh, okay, now that sounds straight orthopedic, right? Or we're like, okay. But then they go, yeah, but sometimes I'm feeling a sharp pain internally. And that's kind of strange. Now I'm going to screen you. You saying that already has flagged. Because a regular orthopedic is going to be more on the outside. I can feel the muscles on the outside of the back, right? Mm-hmm. Or the side of the hip. But if you say it's internal, now I'm going to say, one, do you have the incontinence? Like you said, incontinence is just the fancy term for, urinating on yourself. And there's different.
Pee a little bit.
Yeah, you pee a little bit. So exactly. So it could be stress incontinence, like laughing, coughing, sneezing. Functional, meaning like every time I squat, I pee, or jump, I pee. It can be, urgency, right? Or it can be all these things. That's called mixed incontinence. There's a variety.
Yeah.
But
going a little bit as you're going to the bathroom, like running to it's like you're 1 second away, the urgency.
That's the urgency. And sometimes those are habits like you just pulled in your driveway and your body's primed. Or it can even hear the jingle of a key. It's really interesting. And now the body is like, oh, I gotta go. And you're like, wait.
Yeah.
Or you can't hold it as long. Like people should be urinating anywhere between every 2 to 5 hours. That's typically how often we should be having that. And as far as a good flow, you should have a strong flow between 8 to 10 seconds. Okay.
Good to know.
If you have a weak flow, you won't be urinating as long and you might have to empty more frequently. Okay. So these are all things that we have to pay attention to. That's the urinary. So I'll ask those questions. Then I'll ask the bowel question. Okay. How often do you have a bowel movement? There's even a chart that talks about how your bowel movement should look. Right. Yeah. And so we look at all these things and that gets back into, like we said, the hydration and the nutrition. This is why it's so important, guys, because that affects your bowel and that affects your bladder. And then there is the sexual function. So that's usually my last question. If somebody is sexually active, then like I said, I want to know, is it painful? And how is it painful? Because it's not meant to be that way.
Right.
And it shouldn't be that way. I understand everybody has different preferences, but clearly there's a threshold.
Yeah.
And that threshold we need to be paying attention to. And if you're having bleeding, you know what I mean? Are you bleeding during that? Any of those, bowel, urinary, or intercourse.
Yeah, we shouldn't have blood in any of those situations.
You shouldn't be having that at all. So if you're having that frequently, you need to be seen. you need to go into your OB or, it's depending on the habits. There's gastroenterologists are for stomach, bowel, urinary, urologist is urinary, OB is more for sexual. And any of those can refer you to pelvic floor if they feel there's a dysfunction in those muscles. And all that means is the muscles are not appropriately relaxing or contracting to do any of those things. And those muscles connect into the hip and the lower back, which is why you might say, I have a hip or I have a lower back pain, but it's more internal. And ladies, especially following any type of procedure, hysterectomy, abdominal surgeries, birth, any of these things, you guys need to be paying attention because, that's when a lot of these dysfunctions arise. And depending on the situation, you can get prolapses, which is where things are coming out of place. Now things are coming out of place and hanging out.
Like intestines specifically, right?
Like literally, like they're literally organs and intestines. They're coming out of place. Hernias.
Yeah.
There's for males, there's inguinal hernias. Females, there's hernias, with umbilical hernias. We need to be paying attention. And one of your other questions was something that is not commonly discussed, but diastasis recti.
Yeah.
That's another one, which is where the abdomen is open. It's not open as in like you see everything, but there's a separation in that muscle.
Separation.
And it should not be more than 2 fingers. If you guys are having these things, the core along with these muscles, the hip, the lower back, it is a system, guys. It is a system. How you eat, drink, sleep, and move, it all plays a part.
I love how you reminded, I think I've spoken of like the urinary incontinence and pelvic floor issues and strengthening, relaxing before, but thank you for reminding us of the bowel habits, because I also see this, playing a huge role with our nutrition, affecting our bowel habits, and then athletes as well. And so in the population that, and just being female, sometimes we try and hold in our gas. We don't want to let it out, or maybe we're manipulating our diet in a way where we've got too much fiber and we're actually getting constipated.
Yes.
The way we have to push, and that's affecting us.
Yep.
I also see the opposite in athletes where because of how active we are or how much caffeine we're consuming, like it goes out too quickly.
Yes.
And so it's just that reminder that, again, the relationship between your nutrition, your bowel habits, and therefore how your pelvic floor functions. And when I personally went to see a pelvic floor therapist last spring, I was reminded, I had never thought of it in this way, that the muscles, the internal muscles in your pelvic floor is kind of like a bowl shape. Your pelvic floor is bowl shape.
Yes.
And you think about gravity and all the important organs in your body from the waist up, from the pelvic floor up, that these muscles are holding in all day long.
Yes.
And then all the food that you're putting in your body and how much you jump around. It's like, wow, I always think about my biceps and my quads and my abs, and abs are kind of part of it, but I had never thought about muscles in your pelvic floor before that are holding in all my internal organs. And every time I'm holding my pee or poop or whatever it might be, this is having a huge effect, which is all day long. So I think this relationship between nutrition and our bowel habits and our bathroom habits is really important in our pelvic floor function as well. So thank you for bringing that up.
And I think that's perfect. And like you said, and to be clear, it's not as easy as going on YouTube, guys, and researching what's a Kegel. That's good education. But there is, believe it or not, a right way and a wrong way to do a Kegel. And there really is.
Yeah.
And that's why if you're really struggling and still having symptoms, it's important to see a specialist because they can appropriately teach you how to do that through various means. Okay. Various means with internally externally.
I agree, because I had the knowledge and I knew the exercises, and I was still, something was a mismatch. It took me only 3 appointments with the help of a specialist to figure it out.
And sometimes that's all you need. Sometimes that's all you need, guys. It doesn't have to be forever. When you have a trained individual, they can get you back on track like that. You'll have this symptom reduction. Like I said, they'll go through the gamut. One of the questions we ask those about nutrition, not because that's our specialty, but because we know
Plays a role.
it is a major part in it. So yeah.
Yeah. Thank you, Kelly. And thank you for spending the extra time. I loved all of our topics. I have some fast questions because I know you got to get going that I ask all my guests, super speed.
Okay.
If there's one food you could eat every single day for the rest of your life and never get sick of it, what would it be?
Oh my goodness. Cauliflower mashed potatoes.
Whoa, haven't heard that one before. Amazing. You love it.
I love that. I do. I love mashed potatoes. I like the healthier version now, the cauliflower mashed potatoes. It's good.
Awesome. What is your favorite sport to participate in?
Tennis.
And what about as a spectator? What's your favorite sport to watch?
Football.
Amazing. All right. The hardest question. If there's a female athlete out there, whether well-known or in your personal life, that you want to give a shout out to for any reason, who would that be and why?
The Williams sisters, Serena and Venus.
Makes sense with your passion for tennis. So
yes,
they are incredible and inspirational, amazing athletes. And I don't know them personally, but they seem to be amazing human beings.
They do.
Along with you, Dr. Kelly Baez, thank you so much for all your work, the patients you treat, the setup of your practice, and also all of the nonprofit work that you do as well. Thank you so much.
Well, thank you. I really appreciate you. Thank you so much for having me.
And for people local to your area, we'll include links to your websites and how to get in contact as well in the show notes.
Perfect. Thank you so much. I had a great time. Thank you, guys.
Well, everybody, thanks for listening. I really hope you enjoyed that episode. And if you did, if you are a true fan of female athlete nutrition, then I would love if you could support our podcast by spreading the word. Share a review on your listening channel, give us 5 stars. It really helps get the word out and get the show more views to positively impact others. Also, you can support the podcast by joining our Patreon. Head to patreon.com/femaleathletenutrition to consider a donation, or even better, join our membership where you get extra monthly content and perks. We don't want you to simply listen alone. We want you to be a part of a community and a movement of fierce, fit, and fueled female athletes. So patreon.com/femaleathletenutrition is where you can do exactly that, learn more, and join. A huge thanks to our affiliates and partners as well. Once again, Prevenix, Inside Tracker, Orgain, Practice Better, Jen and Carrie. Please go check them out, and their links in the show notes where you can get deals and discounts. Last, be sure that you do more than just listen. If you need help with fueling, it's time to take action. Head to my website to learn more. You can either book a free call with me to learn more about our coaching programs and how we can work directly with you, whether it's the fast track or otherwise. Or you can take our online self-study course, Female Athlete Nutrition. You can literally sign up and gain access right now. You can explore our downloadable products, including the Red S Recovery Guide, High Iron Fueling Guide, or if you are a coach of a team, check out our brand new Coaches Toolkit for teams. You can also just learn more. We have a blog, a Red S quiz to see if Red S is affecting you. If you need help, I want you to get help fast. Too many girls and athletes struggle with nutrition, but you don't have to any longer. You can rise up with the power of nutrition, take action today in any of these avenues, and become fierce, fit, and fueled. Links in the show notes, and we'll see you next time.